I would also like to address a common concern that people say, enabling people to experience different experiences or different states of consciousness sounds very enlightened, and then people tell you, and then someone becomes psychotic and they're in real pain. Yeah. And why can't we help them? We need to help them. They're not functioning. They're harming their reputation. They're losing their job. They might be causing damage to their family. They would say it's irresponsible to not stop it.
But that's not what we're talking about here. Is not helping. We're talking about how to help. How to help. And then certainly there's all kinds of situations where you want to get someone back down to reality. You want to get someone to calm down. But again, it's like the example of someone who's crying. Is it necessarily best to stop the tears right away or give them space to express and to talk about why they're crying and to think about what might help them so they don't keep crying or cry again and again and again because they're in a situation that's saddening them or that's disempowering them. So there's a false response which says that, this patience movement, this recovery movement is trying to just, be about civil liberties and just let people do whatever they want to do. Yeah. But no, what we're about is having a better social response. We're about how to help people, how to really help people. Because what we're seeing is that just medicating and putting into the hospital maybe helps some people, but a lot of people are getting traumatized by it, and people are not, being able to move on with their lives, not actually getting better. So it would be a misunderstanding to say that what we're talking about is about not helping people. It's just about what kind of help that we want to give them, not a fear-based help. We don't want to give them a medicalized help that just assumes everything is a disease. And we don't want to be pushing toxic medications, which may cause more problems than they solve. We want to actually spend time with the individual to find out what's going on, give them a space, a sanctuary, and that, sometimes you do want to just help medicate the person or get them to sleep or calm them down so that they can get on with their life. And that's useful, but how do you frame that? How do you approach that? Do you mislead someone? Do you tell them they're going to need medications for the rest of their life, or that medications are the only way?
Or that there'll be brain damage every time they experience psychosis? If
they don't, there's many different messages that psychiatry tells people that can be very, very frightening to people. And this idea that, that psychosis is like an out of control infection that's eating away at the organ of your brain. There's no research evidence that supports that at all.
I was so surprised to hear one of the psychiatrists actually admitting to that in our workshop. She said, it's not, there's no evidence based that psychosis causes the brain damage.
Yeah, there's definitely a reason for concern if someone goes into crisis that they could go in again. And maybe it be that someone goes into crisis, maybe it's easier to go into crisis the next time. But is that brain damage, or maybe that's habit? Maybe it's the stress on their body. Maybe it's their circumstances are not changing, and so they keep going back into the crisis. So we definitely are talking about getting help early and supporting people early. But we have to really step away from these messages that falsely lock us in to a medication and hospital response, because that response can be harmful. And there's a lot of mysteries to the mind. We don't even know how consciousness arises from the brain, or even if that's the correct way of understanding it. There's lots of mysteries here. So I'm interested more practically. If someone is using a word like bipolar, they're talking about brain chemistry or these kinds of things. Okay, but practically, does that mean that you are believing that you can do nothing, that it's your destiny and your fate? It's written into your genes that nothing can be done. You must take. Or is this something that's maybe more empowering for you? Is it helping you to feel connected to other people, or is it making you feel afraid of yourself and disconnected? I mean, there's lots of views of the brain, for example, and genes now that talk about how the brain is shaped and changed by its environment, that genes are turned on and off, and that the brain chemistry is changing all the time. And so people want to think about things in those terms. I mean, that's their understanding. The question for me is is there a way of seeing things, locking them into a disempowered and isolated view that forecloses certain kinds of options that need to be explored, or is there a way of seeing things really supporting exploring and discovering and trying different things? Because no one has ultimately an answer to what madness is, or even what the human mind is. So we have to kind of think pragmatically about what we can actually help people with, what actually is useful to people.
Okay, so what's actually useful?
Well, we've been talking about it. I mean, I think like any kind of emotional distress, I think reflects a sense of being out of control and being isolated. And so creating spaces where people can be listened to and supported, and maybe having safe spaces where they don't need to take care of themselves, they can be looked after, and there can be a certain kind of attending to that person can be very, very useful if they've dropped out of their capacity to kind of take care. And being willing to be curious and explore and discover what might be useful for them, and having a very experimental attitude. Maybe it's nutrition, maybe it's exercise, maybe it's repairing problems in the family, maybe it's helping the person to get some hope, maybe getting the person back on track with what their dreams and goals are, maybe it's exercise, maybe it's connecting with their spirituality, maybe it's unearthing some trauma that they've been through, maybe it's getting them in touch with their body. There's so many different things. Maybe it's just time. Maybe the person just needs time and space to sort it out for themselves. There's so many different things. Again, it comes back to this idea of diversity. But if we don't take the time to listen and give people the space to be, then they may miss that opportunity to really heal what they're going through.
Wow. So many thoughts still running through my head. I don't know. I remember when I showed a psychiatrist friend of mine the invitation to our workshop of harm reduction approach, and she said, "Oh my God, that's so dangerous! There's so many pedophiles in this country, and so many murderers, and such danger." And I recently met a reformed sexual offender on the train, and we just had a whole political issues around releasing sex offenders to community because of bad accommodations at the jail. So they released 1,000, and there was a whole social buzz in the newspapers that that's so dangerous, and what are we going to do? And I think that what you're saying is so substantial, that if you treat those people who hurt other people, they've been hurt. If you treat them properly, if you treat their own traumas properly, they can lead amazing lives. That person I met, he says to me, I was so honored that he trusted me to tell me he was a recovering sex offender. He said, "Don't hate me." And he felt comfortable even saying that. There's so much shame there, and he says his life is totally reformed now. He got married, he has a job, he wants to study social work, he wants to help other people like him. And I met him, and I was so inspired by that amazing person. And if I put the label on you, I would say, "Oh my God, I need to run now, run for your life." And I see the how parallel our the way we treat sex offenders and the way we treat people with psychosis is not all that different, in my perspective.
Yeah, there's an incredible fear. There's an association with violence, and there's a label that silences and ignores the individual. Now, I mean, sex offenders are a very broad term. It means lots of different things. In the U.S., it can mean, one thing that might seem quite innocent, like being, naked in public, or having sex in public, consensual sex in public, but then someone reports you, and then it can also mean something much, much more serious. So we have to kind of step back from the label, often also because it's tied to the criminal justice system, being put in this category of sex offender often just means you didn't have enough money for a good lawyer. That's basically what it means. I mean, we have I don't know about Israel, but we have a very unjust criminal justice system in the United States that rewards those with money. So, but you're talking about an area that's very different than mental. I'm talking about crimes, when people have committed acts of crimes and violence.
So
and
many times there's a connection that people say if you have a mental health problem, you must be a criminal.
But that's what I'm trying to break. That it's actually not true. That the research is really clear that people don't have a higher rate of violence. That there's fear. There's often, very sensationalized tabloid news, media accounts of someone who's done some horrible crime and who has a diagnosis of schizophrenia or who is, going through some kind of crisis. And then that gets held up as being an example for everyone. But this is fear. This is not meaningful public health policy. This is just fear and tabloids and scapegoating. And so, there are situations where, violence is happening, crimes are happening, and we have to be very clear about that. That's not okay. That society, we're not talking about just condoning someone because they have a difficulty or they have suffering in their life, or that they've been through trauma, or they have a mental health issue, that therefore it's okay to commit acts of violence. I mean, people do need to suffer consequences and have some kind of response. True. But I agree with you that there needs to be some kind of dealing with the whole person, understanding why they're acting in a violent way. Sometimes it's a reaction to something that's happened to them or happened to them in their past. And then to not just, throw away the key when we're punishing people. They're recognizing that people change and they grow and they learn that actually, the fear of reoffending is a big fear. But actually, from my understanding, that sex offenders have a lower rate of what's called recidivism, of reoffending, of continuing to commit another act of violence once they've been caught and punished for it. So that the fear that people are going to re-enter the community and then go on and do these things again, and therefore we should keep them locked up forever and ever, it's really not based on what we know about that population of people. It's an exaggerated social fear. Now, is it possible that, sometimes people are going to commit an offense again? Yeah, they could. But there's an approach to justice and criminal justice that society has, where someone is arrested and they are given a certain punishment, and then once they've done that punishment, then they're kind of given the benefit of the doubt, and then they're released. And sometimes that happens, that people do offend again. So I would ask, well, why did they offend again? Maybe they're not getting enough support. Maybe there's not enough social options for them. But when someone has a psychiatric diagnosis and they do commit an act of violence, we don't ever give them the benefit of the doubt. We just punish them and say, okay, now we're going to lock you up forever. You've been labeled a violent mental patient, and there's no opportunity for you to actually get the justice that someone in the criminal justice system would get, of having a sentence with a definite time limit on it. That people are just often just kept locked up forever. They're never really given any chance to look, grow, and learn and heal in the community. The solution is just medication. So these are complicated questions. I'm not trying to oversimplify this, but I'm saying that you're absolutely right. The framework of labeling, of fear, of scapegoating, of stigma, of not looking at the social context, of not looking at the history of trauma that someone has, the framework of just obliterating all of that and then blaming the person as being different than us, that is a big social problem. It happens in the criminal justice context. It happens in mental health. It also happens in world politics. It happens throughout society. It's a big, big problem that we have as a species, that we're very quick to, out of fear, consider the other as fundamentally different from us. And then once we do that, the door is open for us to mistreat them and commit acts of violence of them and basically consider them subhuman and then harm them and oppress them. And that's one of the reasons I think that we're, working on the mental health issue, is because we have a vision of a better society. We don't want to keep operating with the same kind of dynamic of separating us and them and treating the other as if they're not worthy and not listening to the other and not respecting. That we want to actually have a society of caring and compassion and respect for each other, and mental health is one of the places that we can do that.
God willing.
God willing, yeah.
You know, a lot of people come with really good intents to work in the mental health field, and sometimes along the way things go the other way.
Yeah, they end up in the mental health field. It doesn't really. A lot of the motivation is caring, and sometimes people's own experiences of struggles. They get into the profession and they have to hide their own experiences with struggles, and then they end up doing very uncaring kinds of treatments for people.
Wow,
Yeah.
that's so, I can really relate to that, you know.
Yeah.
I think I became a mental health specialist because I had such a bad experience of other therapists. I say, I have to learn how to become a better one than what I received, because I saw someone who was looking at me like trying to be a blank screen, and you know, going listen and going, I see. That's very interesting.
Yes. Right.
And I felt alone.
Yeah.
I needed my therapist to be authentic and to be with me. So I know that it's not an easy question when you come to speak about the differences between, like, I think there's a little bit of a difference between the rehabilitation approach and the proper clinical therapist approach. But you know, I'm trying to make them really separate, and there's so much diversity in the middle. So I don't want to sin and overgeneralize, but in general, there's I feel there's more openness in rehabilitation people in bringing who they are to the table, to the process, than what I feel there is in the clinical therapeutic environment. I know there's people all over the spectrum, and I'm not saying this is this and that is that, but it really helped me to having people who relate to me authentically. You know, we say in Hebrew, begova einayim, at your eyes height, looking you in the eye, straight in the eye, and being authentic. And that was such a main thing for me that was missing. And that's what I got from my peers. I think that peer support was such a main, what do you call it? I forgot the word. Mash'ab. Resource. It was such a main resource in my recovery process. You know, people who, you know, you call other people my brother, my sister. True. People who understand where I come from, what I've been through. And I think those issues of identity also have a really, really big role in this whole scene we've been painting. That also the after going through things like that, the things that you trust most about yourself, like your emotions, your thoughts, your feelings, everything, it misleads you. It brings you to somewhere not so simple. And then you say, okay, so I don't know, can I trust my feelings? Can I trust my thoughts? Can I trust myself? And your whole self-confidence is shattered. Shattered. And it's so difficult to rebuild all the pieces together and to glue together your identity and to make maybe something new. But I think that process is difficult enough as is. And then you put on top of it the medication, which is great, because then when at least in my experience, when you put on top of all of this the medication, okay, so you tone down the emotions. But I was looking at my eyes in the mirror and I was saying, who is that? That's not me. I don't know this lady. I felt like someone robbed my identity. And that was a price I was not willing to pay.
That's very similar to my experience on antipsychotics. It's feeling like I just wasn't me and my personality was missing.
And that I was so mad. You know, I know righteous rage is one of the ways
Yeah.
to cope with stigma,
Yeah,
but you
yeah.
know, I felt it was just.
Yeah.
It was like,
Yeah.
it's my identity. I did not give anyone permission to take it away from me.
Right.
It's,
Yeah, I would much rather be chained to the wall than forcibly medicated. Absolutely, because if you're chained to the wall, at least you have your mind.
Yeah.
You know, if you're medicated, then you're in this numb. Often you're in this numb state. You're in a chemical straitjacket that goes right deep to the heart of who you are as a person.
Exactly. That was very painful, and that's why I was very determined to end my affair with medication.
Yeah.
But as you said, I appreciate the fact that everyone needs to find their own way. And I really hope that we have enough facilitators, professionals of all sorts, wide range of professionals, like you said, also alternative medication and personal medication and all sorts of healers of all kinds that can learn how to use a wider approach like harm reduction and help people have a safe process to find their own way and their own balance. And it doesn't have to be either or. It needs to be a process of discovering and enabling and finding their own balance and finding their own voice. And that's so complex.
Yeah, I mean it's complex, but it's in a way it's simple.
Yeah.
Because that's how we live ordinarily. That's sort of what we're always doing. Everybody's just sort of finding their way. But somehow when you become a mental patient, that sort of dignity of self-determination is just sort of taken from you. Oh, we're going to assume that you can no longer take care of yourself or explore, or your life is no longer a learning process, or you can't risk making your own decisions and failing and learning.
Exactly.
That we take that away from people. Yeah, but it's actually a very, very common sense thing. We just have denied it to people once they get into this category. Because we're afraid. It's so intense, it's so overwhelming. The pain is so much. The volume of the emotions is turned up so high. The stakes seem so, they're losing their social role, they're not working, they're in danger, there's suicidal feelings around, the family is falling apart, that we just lose some of our common sense about how to respond to each other as human beings. Then we go into fear mode, and that just fuels the problem as far as I can see.
Exactly. Wow, I can't thank you enough for your time and your inspiration.
Well, thank you, Shira. It's really great to be here and talk with you.
Thank you.
And thank you for all the work that you're doing here in Israel.
Thank you for all the inspiration and the backwind that I received from you.
Oh, great.
And we really hope to see you again.
I'm looking forward to it. All right, thanks a lot. Thanks
Nice
everybody.
having you.
Thank you.
Thank you. Thank you too.